Hello, ladies and gentlemen. Welcome to Triple N Media. I am Dr. NIK NIKAM, and in this presentation, I'm going to talk about the socio psychological effects of aging and retirement among physician population, and it can apply to any professionals, be it the executives, pilots, engineers, presidents, anybody it would apply. So let us look at some of the important things that we face as we get older and see how we can deal with them. There are definite social and psychological, physical and emotional effects that are going to supersede our age and retirement years. So it is better to have a knowledge of what we are going to be facing so that we can prepare ourselves in the best manner possible to live a useful, productive life in our aging years. I don't know who coined it as golden years. They must have been on some stuff to call it golden years, but it is anything but golden years. But we can make it a lot more tolerable. Okay, first of all, in the United States, there are more than 1 million physicians, of which 50% of them are over the age of 50 years. And 30% of these physicians are over the age of 60 years. And 70% of the physicians are 70 plus years. And majority of the physicians 70 plus year are in active medical practice, not only doing patient care, but doing surgery and all kinds of procedures. So it becomes important for us to understand how good we are at age 60 and 70 compared to when we started off at age 30 or 40, when we were a lot more energetic and a lot more enthusiastic about life. Anyway, here's an important statistics I want you to keep in mind, because this affects every aging and retiring person. It doesn't matter what profession you come from. That is, there is a 20% decrease in the cognitive ability of people between ages of 40 and 70. So I'm not talking about 70, 80 or 90 years old. I'm starting off with age 40, going all the way up to 70. There's a 20% reduction in our ability to, one, perceive things, number two, react to them, and number three, have a knowledge of what is happening around us. So we lose the ability to comprehend what is going on to a tune of 20%. That's a significant number, especially if you're a surgeon, a heart surgeon, doing your surgery, and if your hands are shaking like this, you know you're not going to be having very good surgical results. That's maybe an over-exaggeration, but I have seen this. People with Parkinson's disease who have these shaky hands may not be able to function as they were when they were in their heydays. Anyway, another important point is that 57% of the adverse medical events that were noted were seen in these group of people who had shown a 20% reduction in the cognitive functions of their brain. So there's a correlation between loss of cognitive function and increased incidence of adverse medical events. That's an important thing we need to keep in mind, because we may not recognize it ourselves. We may deny if our friends are telling that, hey man, you are not doing properly, you're forgetting these things, you put things in the wrong place, you did the wrong suture. We may not listen to them, but things are real and we need to pay attention to those things. Let's move on. The percentage of people over the age of 55, as you can see, pulmonary doctors were like 89% accounted for that. Preventive medicine, 69%, and pathologists, psychiatrists, 61%. So there is a significant number of people, especially in the preventive medicine and pulmonary medicine where they are 55 years or greater. That means there's higher incidence of cognitive dysfunction in these physician populations. Okay, how serious is this cognitive impairment? Is it something they can't even figure out where they put the keys, or they don't remember which house they are in, or they don't remember their telephone number? Well, here is 10 to 20% reduction in the cognitive function was noted in people over the age of 65 years. These are mild cognitive symptoms, whereas major cognitive impairment was seen in 13% of people 65 plus years. And in the general population, the cognitive impairment was of a tune of 13%. So it is very comparable to the cognitive impairment seen among the physicians as compared to the general population. All these things come into play as to how we prepare ourselves in our retirement years to see how best we can function, enjoy our life, avoid problems, and try to stay sane. There are questions about older physicians practicing in areas like neurosurgery or heart surgery. Should they be having cognitive tests? I think they should be having cognitive tests. Even the President of the United States should be having a cognitive test if they don't seem like they are functioning properly. I mean, it's just a matter of safety of the people they are dealing with. There are many aspects that affect as we get older: physical, psychological, emotional, financial, and relationships. All these factors have to be taken into consideration. Now, let's talk about just the physical limitations. We can have arthritis or any other condition that can limit our physical activities. It can limit our mobility. It can limit our ability to drive. And also, we may have multiple medical problems for which we are spending half of our time visiting doctors' offices and lab studies. There could be a significant problem related to the spousal health, where 90% of your time is spent in taking care of that spouse who has cancer or arthritis or something that is incurable. Then some patients may have substance abuse because of inability to cope with the stress of retirement and aging. And most of people, as we get older, we're going to have vision problems, hearing problems, poor appetite, constipation, I mean toothache. I tell you, Arma Bumback calls this as the metallic age. Silver hair, golden teeth, chromium stent, titanic hip. Yes, it is a metallic age. It is a metallic age when nothing really works or moves. Anything that moves hurts. You get the picture. So how do we live ourselves in this metallic age? Maybe because we are in a metallic age, somebody just put in a gold there to say it, golden age. That is the most deceiving term ever coined for aging population. So when we are in this metallic age, we not only face physical limitations. Now let's talk about the psychological effects. First of all, let's face it. I was trained to be a cardiologist. I practiced for 40 years. I just retired last January, and combine that with the COVID restrictions, I have hardly left the apartment. I live by myself, so I hardly leave the apartment, and it has compounded a lot of the things that I never expected, including uncertainty. Even if the phone rings, my heartbeats go up. Just so many things happen. You just have to understand these are things which are going to happen, and they are a normal process of evolution. First of all, if we are in a relationship, let's face it, nobody has been trained to spend 24 hours, 7 days a week, 365 days with a spouse. If you have been trained and if you have been successful, please put your comments as how you are able to do it so other people can deal with it. Because as human beings, we have differences of opinion that can raise to anger, resentment, frustration. Financial problems can creep in. And it can also lead to anxiety, panic attacks, uncertainty, and mood swings. Oh boy, you're talking about mood swings. You may have to learn to live with mood swings of yourself and your spouse. How about that? The $1,000,000 question is, how do you keep that sparkle going 24 hours, 7 days a week when you're retired? You don't have a job to report to. The safe haven you had when you were working, now you have to answer to every question your spouse has. If she says sit down, you sit down. If she says stand up, you stand up. If she says go get the milk, you do it. I mean, anyway, so these are things that we have to keep in mind. Now let's talk about some other problems that can creep in. As we get older, we develop hypertension, diabetes, heart disease, arthritis, cancer, colon, whatever it may be. But the problem is your doctors are going to stuff you with 10, 15, 20 medications. And when you're taking all these medications with your age and reduced ability of the body to handle these medications and side effects and interactions, we could get sick just by taking these medications which were intended for a good purpose to start with. But that's where we had to do the delicate balance. It reminds me of a patient who used to check his blood pressure 16 times a day and he said, oh, my blood pressure is 200 now. What do you expect me to do? He used to call me every 3 hours. I had to tell him, just don't check the blood pressure. Take some medication, take a little nap for 20 minutes, and then see what's your blood pressure. So the rise in blood pressure can increase anxiety. Anxiety can increase your blood pressure. So it becomes a vicious cycle. And when you keep doing this, your blood pressure is going to shoot through the roof. And that increases anxiety, that increases frustration. And now you got a quarrel between your spouse because you're not taking care of yourself. It's a never-ending story. Okay, drugs are important aspects of life we need to keep in mind. Okay, how do we differentiate between an acute illness from this slowly creeping up neuropsychiatric diseases or symptoms? Well, of course, if you have a heart attack, you're going to go to the emergency room, the doctor is going to tell you got a blocked artery, they're going to put a stent, and then they're going to give you medications, and then you say, okay, I'm going to keep on going. Or if you had a stroke, then you're going to be physically limited. You have to go through rehab, and hopefully you recover, and then you go on with life. If there's a trauma, that's a different story altogether. And of course, if there's a loss of a loved one, a family, be a spouse or a child, that's going to create grief which can last for weeks, months, or years, which can totally change our perception of life. See, I'm talking about all these new challenges that we face as we get older, or say younger. Then adjustment disorders. I told you, when we were working, we had several people around us listening to everything we said and following our instructions. But when you're at home, you are following everybody else's instructions and you don't have a voice whatsoever, especially if you're a male. Maybe I shouldn't say that, but anyway. Okay, now let's talk about, you want to spend the time with your spouse because you spent 60, 70 years working for somebody else. You spent all that time, you made your money. Now you want to spend these golden years with the most beautiful lady in your life, and you are ready to get going. But thinking all the things I told you about challenges we're going to face. Or you may say, wait a minute, I've been a doctor for 40 years. I know my job. I can certainly help some people. So what I'm going to do is I'm just going to stay in my practice and practice part-time, half the time, 3 days a week and all this. There are many physicians who have tried that and they had bad experience. And I'll tell you why. The young physicians don't want these old physicians interfering in their practice. They say you're old school. Nobody practices medicine like you do. That was good for the 1900s. This is 21st century. So you're just going to clash. As a result, you may have to get out of the kitchen. That's one of the scenarios you have to keep in mind. Okay, then they say, oh, I'm going to keep myself busy in social media. And today we got so many different options. Social media is one of the most disheartening, addictive thing that you can ever do, because this is going to isolate you more and more from other people in real life, because all of this internet media are doing is stealing your time, stealing your intelligence, stealing your expertise, your resources, and basically all you're doing is staring at a screen. One day I was staring at the screen for 18 hours, then I started getting severe neck pain and my blood pressure shot up. I said, this is it. I'm just going to throw that iPad out and focus on something physical. You have to physically interact with other human beings. We are a social human being, and it is important for us to interact with people face to face. Forget about all this social media. This is just a gimmick, an addiction to take your time away from a social existence, because we used to go to parties. Of course, the last 2 years because of COVID, we have not been able to do anything, and that has added a lot more stress to me. And I can tell you, I said there are days where I didn't even leave my apartment because the weather was bad. It was COVID and there was nothing else to do. So all I could do was just stare at the computer monitor or the iPad. But I would say just dismantle all the social media, because that is not the right way to get your energy and resources utilized to the best extent. And here are some very, very useful tips I have as how you can keep yourself engaged. You need to get yourself engaged in a social interaction with other human beings, and may not be in your own profession. It could be a different profession, but don't try to start a whole new business like I try to do. I try to learn the insurance business and try to do it. It's not worth your time at age 70 to start a new business, go and dig up from the start. I would just say find something that is useful where you can interact with people. I mean, the key word is physical interaction with people. And then I say, for example, you can take up writing, you can take up painting, you can take up hiking, because here you meet people of like kind. Then music is a great way, because you can share your music, you can learn music, you meet people, and those are the things. The other thing you can do is volunteering. Volunteering in a library is infinitely more engaging than working on a damn social media. I'll tell you, social media is just there to make money out of your free time. You are a free employee of every social media that you interact with. You are the product of those social media. So they are taking your personal information and selling it to the highest bidder. Or else you can also teach. You can teach younger people, volunteer teaching, so they are very happy to learn. There are people who like to learn English, who came from different parts of the world, whose English may not, their English may not be the first language. That's something. And the one more important thing is we all need to get engaged in some kind of physical activities. Physical activities. See, learn to move your joints. The more you move, the better it is. And remember, Irma Bambach said, nothing moves and anything that moves hurts, but you need to reverse that cycle. So just do the exercise. All right, ladies and gentlemen, this is my quick overview of a first year of sort of semi-retirement, because I wanted to go back and work. Because of the COVID, I could not do it. And this is what I have collected, the information. I hope this will be an eye-opener for you. And if you have any suggestions as to how we can make our life better, please leave some comments. If you want to start like a Retired Physicians of Texas Association, something like that, let me know and we can go ahead and start one so that we can share our common concerns, our common successes, our common tips. Thank you so much, and please do watch our YouTube channel. See you next time.